Welcome back to Alive and Well Community's Daily Dose, your daily dose of support. Now, today we're going to talk about more resources that are available in the greater St. Louis region, and we're going to work with some of the architects behind this initiative to talk about not just the resources, but the purpose of the initiative and really the why behind it. And so I'm so excited that we have some very special guests with us today. We have Rebecca, who is the founder and principal at Emerging Wisdom here in the greater St. Louis region, a consulting firm. And she is also leading the community outreach and engagement for the Prepare STL initiative. In addition, we have Angela Brown, who is the executive director and CEO for the St. Louis Regional Health Commission, an organization that's really charged with protecting the health safety net here in the greater St. Louis region. So to our two phenomenal guests, thank you so much for taking the time to join us on the Daily Dose. We're so excited that you're here with us to talk about this important wisdom and the resources available.
Thank you for having us.
Thank you. Good morning, everyone.
Good morning.
So I want to start by just asking, can you share a little bit with us about why Prepare STL came about and its goal and mission?
Certainly. Go ahead.
You go, Rebecca. Oh, well, really this was a work around looking at the health disparities that we've seen in our communities historically, and understanding that usually when things happen, our underserved communities are not necessarily the focus of topic and necessarily looked out as priority. And so we came together, a couple of organizations, Integrated Health Network, Alive and Well Communities, also with the St. Louis Mental Health Board and our city and county health departments, and really wanted to put out a message to the community that was targeted towards our communities of color, particularly our African American communities, as well as those immigrants, new Americans, and our seniors, to let them know information about what's going on with this COVID-19 pandemic, and really want to help them have ways and understand how they can take action to help stop the spread of disease, and also understand resources that are available to them during this time. And that's how we came up with the campaign Prepare STL, that was really focused on how can we stop the spread of this virus, particularly in our underserved communities. And if you've seen a lot of the data that's been out, Dr. Eccles from the City Health Department, at the beginning of April, all of the deaths were African American. And we even started seeing the county that 50% of those deaths were African American. And so it really shows the needs of us to have a message that's targeted towards our African American communities, our people of color, to let them know that this virus is impactful in our community. We are dying at a disproportionate rate, and there are things that we can be doing to really stop the spread. And we want to make sure they have the message out to get that going.
Yeah. And Rebecca, is there anything else that you'd like to add to that?
I think Angie covered it.
Yeah.
Boil it down in a nutshell. We were already endangered, right? So I don't think we need to sort of think about this. One way to think about this is there's a new threat, right, that is imperiling us at a rate that we sort of haven't seen, at a scale that we haven't seen, right? But the underlying issue is that the communities that we were talking about were already endangered before COVID-19. And so we can anticipate, therefore, that members of our community would be even more endangered by the arrival of this virus. And so we are seeking to address and resolve, to the best extent possible, to address the ways in which we are endangered, right? Both by the virus and by the adverse effects of the shutdown, which is a necessary public health mitigation effort to try to keep us alive. And yet it means that it makes survival much more difficult for many of us.
Now, as you both mentioned, we know historically St. Louis falls in line with a many number of cities where zip code is a better determination of someone's health outcomes than any other demographic aspect. And we know that's really rooted in that historical trauma that communities have experienced with either purposeful investment, or as we see in St. Louis, purposeful disinvestment in our communities. And so we know that as the virus has come our way, St. Louis also falls in line with a mini number of cities where our Black and Brown communities are unfortunately disproportionately impacted. And again, we see purposeful investment and disinvestment even during this time. So as you all were kind of thinking about this campaign, I know that you've used a unique strategy and one that's unique to St. Louis that others are now trying to emulate across the country. Can you tell us a little bit about the strategy that you all are using for Prepare STL as we get the information out, as we help people to understand how to stop the spread, the resources that are available, as well as what to do if we're sick?
Yeah, there's a lot there, Sean. I want to do a little bit more framing before I answer you, right? I want to answer you.
Please.
And make sure I don't have anything on my lip. Right? So for those of you, this is real time, right? And like we can see ourselves, which is a little strange. But I want to say when we start talking about, imperiled or endangered populations, we often talk about them as vulnerable. I'd like to say endangered because endangered is an indication that something in the environment, right? It does not come from a place of sort of, there's nothing inherently pathological or weak about the populations we are talking about. Let's be clear about that.
Yes.
Right. What happens is that there are dangerous factors in the environment that imperil the safety, well-being, and survival, right, of our community members. So I want to be clear in that way, right, and that we don't stand outside of those dynamics. And so oftentimes what happens with Black and Brown communities and others is we're like, well, wait a minute, we're not responding to the much of what the media is saying about, keeping our distance or other kinds of things, these other efforts to help slow or stop the spread of the virus. Sometimes we are getting a lot of social critique, what I would call shaming in some ways, about our behaviors and why we aren't taking this thing seriously. And so I do want to offer an alternative frame, right, that puts into sharp relief how these systems often collude in ways that further endanger us. Many of us are essential workers, right? Many of us are still, we are essential workers, and so that means that some of the shelter in place, right, orders and things like that, which are important, we still have to go to work. Because we are taking care of sick people, or we are driving buses, or we are home health care, or we are providing childcare services and other kinds of things for first responders. I mean, in many ways, there are many of us who are still actively engaged in going out because our livelihoods depend on it, and because we are essential, right? And so some of the data has shown that the more affluent we are, the earlier we are able to shelter in place, right? The less affluent we are, and the more economically unstable and uncertain and under-resourced we are, the more that's not the case, right? A lot of people are having critiques or comments about the extent to which we are using personal protective equipment and other kinds of things. You don't see us as much with gloves or masks or those sorts of things. But here's the reality. We didn't have access to those things before, and many of us don't have access now. Right? And so the kinds of things that would keep us safer, the staying in place, the having PPE, and those sorts of things are not as readily accessible to us as they are to other communities, right? So this is where we have to be as aggressive as we possibly can in being able to influence the things around which we have some control, right? And so Prepare STL is sharing important information about what is it that we can do that is within our purview to be able to make sure that we can protect our precious lives as much as we possibly can, right? So there's an awareness campaign about what is it that we do to help us with regard to stress and coping? What is it that we can do to help us stop the spread? Ideally, we would have access to copious amounts of PPE. In the absence of that, right? What can we do? How can we avoid large groups of people if at all possible? How can we keep our distance to the extent possible? How can we practice hand hygiene, right? And clean our surfaces and those things as much as possible, right? Particularly for populations that are going to be more economically and socially engaged because of the precarious nature of our position in our economic and social systems. So we got to really focus on the awareness piece and getting these messages and information to our people as much as possible. The next thing that we have to do, though, is recognize that information by itself is not going to be sufficient, that we also have to couple that information with relationship and with actual presence. So part of what we are doing is an aggressive street outreach campaign or canvassing to help, again, spread information, get information out, be present, and to also help share PPE with those of us who most need it.
Wonderful. No, and thank you so much for that reframing, because I think it's crucial to understand that what are the underlying circumstances, what is at the root cause there of why we're seeing this, and needing to have that clear recognition and understanding. Now, in your outreach campaign, can you share with us how that's organized, what's happening, and really kind of the momentum that you've seen building behind that?
Yeah, if you've ever done canvassing before, right, what tends to happen anytime there needs to be a major campaign around some kind of change, oftentimes you will center relationships and being present, going out to the street, taking the information out to the street, engaging folks around what needs to happen, right? Part of the challenge is that the crisis that we're facing isn't a typical crisis, right? It's a public health crisis, right? And it's a public health crisis around a virus that is spreading and a virus that is contagious. And so some of the things that we would normally do about canvassing and engaging, people are cautious about engaging in because they want to make sure that we mitigate any public health risks, right? And we certainly know that that's important to do, is to protect ourselves as much as possible. And we also know that people will often need to see folks out on the street, will need to get messages and information in order to really take action or to change behavior. So we have organized a street canvass where we've got 80 community members that signed up to help us hit what we are calling hotspots. And those hotspots are essential businesses and services that have not closed down. So they're things that people are still going to use even in the midst of this crisis. That includes grocery stores, gas stations, convenience stores, pharmacies, laundromats, check cashing places, service providers places, health centers, right? These are places that people are still going to for critical life needs or services or goods, right? And in those spaces, we want to make sure that there is clear information about what people can do to stop the spread of the virus, to understand how the virus operates, right? So, you can still transmit COVID-19 even if you don't have any symptoms, to know who's most at risk, right? To know what the symptoms are that they should be looking for, to know what to do if they feel sick, but also to know what can they do to help with the stress of this environment and of these times. How is it that they can cope? And if they have critical needs like food, childcare, utility bills, other services, where they can go to get help. And so we have targeted these sort of essential spaces and businesses to share that information so that community members have access to that. And thus far, we have decided that we are working to reach all of those hotspots in our highest poverty communities in the city and in St. Louis County. And so we are conducting street canvasses that put up posters and other laminated posters and other critical information around the things that I just suggested in those hotspots so that people have access to that information. And thus far, we did a canvas this past weekend. We did 2 canvases and we hit 337 hotspots in the city of St. Louis and in St. Louis County. We've got another canvas coming up this weekend, and we'll probably hit on the order of 210 to maybe 230 hotspots this weekend. And then we've got 3 other canvases that are scheduled.
Wonderful.
Hey, Sean, I just wanted to add, I know Rebecca does this all the time. This is really, she's been the brainchild around our canvassing work. But for those, I think people who are a part of some of the systems that have created the infrastructures that we've seen, this is a very unique thing for them. Many are questioning why. And I think just to celebrate the fact that these were people from the communities that have a passion for their neighbors, that are out wanting to make sure they pass this message along to their, their family members, their friends, their communities, to ensure they're staying well, alive and well. And so I think that is very important that we hit on. And we had people that were a part of the beginning of this that helped even come up with the name Prepare, that was really pushing the fact that people, there were those who wanted Stop the Spread, but how important it was to say, we're at a time we want to prepare STL to really help actionalize our communities. And so I think some of the significant and the importance of having that voice at the table from the beginning and really help to spearhead this throughout is just important to highlight for those who are not necessarily a part of the grassroots movement.
Campaign, right? It's powered by community members, with community members, for community members. Right? We are not afraid to be in the places that we need to be, which is where we live, where we shop, where we work, right? In order to help save our lives. Otherwise, we're going to be at those same places, but we're going to be at those same places trying to take care of sick people and collect bodies.
Mm-hmm. So you had over hundreds of volunteers come in from everything from the organization to brainstorming to identifying hotspots, and then to community members stepping forward to support their community and build these relationships and be visible. Now, I know that the community engagement and outreach is just one component of this larger campaign. And I know that you all have also built this really amazing website and resource for people to get even more information and to have up-to-date information at their fingertips. Can you share a little bit about the website that you all have used for this initiative?
Sure. So our website is called Prepare STL. It is down there on your banner. It really goes around our flyer that we've seen. It talks about what the virus is, what to do if you're sick, and then where you can go for resources. It also has an about page that lets you know who we are and some of the reasons behind this campaign. There are also videos from our influencers in the community. So Jade Harrell has done some stuff for us, as well as others to help get the message out from recognizable places. But definitely for those of you who are at home, need resources, are trying to figure out how to get transportation, you need Wi-Fi because we moved to this work from home environment, utility support, there's information there for you. Just information about the spread, what to do and how to stop the spread. So a lot of valuable information I think that people need is very simple in plain language. So we noticed that a lot of our websites related to this have very dense, a lot of information, very hard to digest. And so we wanted something that was simple, easy for people to understand, where they can get a message and take away quickly. And so that's what we have here on this website. And we really want people to come out to preparestl.com as much as possible to figure out what you need. We're trying to update it daily. Again, as our canvassers out on the street, as they get information back, we want to make sure that we have the right communications here that we're sharing with our population.
Indeed. And you'll also notice other things on there, like how to get your stimulus check, even if you have not filed your taxes, right? Because we know that financial assistance and cash supports are going to be even more critical and crucial for families. Remember, we have two primary aims. We want to help our we want to help our community members that are most endangered by this virus, A, stop the spread of the virus, and B, be able to survive the shutdown, right? So we got to help folks get through this period of time. And so we've got lots of information that supports community members in doing both of those things, right? And our website is a part of an even larger sort of social media and conventional media campaign effort that's being led by another aspect of our team, Vector Communications. But we've got the website for people to get information. We've got a lot of a big social media presence as a part of this. We're doing a radio takeover this Friday, Sean, of 95.5, which is our local R&B station, and 104.1, which is our hip hop station. So from 10 to 5, people will be able to get information on this campaign and on what it is that we are doing and our community partners are doing to help keep our community not only alive and well, but prepared.
Wonderful. Thank you so much. And I love kind of the multifaceted mechanisms you all are using to get out this information. And it's not just about stopping the spread and what to do if we're experiencing symptoms, but also, as you mentioned, how is it that we stay actually alive and well during this time, recognizing the economic impacts. So thinking kind of holistically about this process and engaging in different forms of media to reach our community. Now, as we're looking at the website, I want to ask, is there anything you want people to know about the website as they're coming to this? Anything you want them to see so we can kind of show them as we're filming this broadcast to direct their attention to so they know what's available and at their fingertips?
I think you are featuring the thing that we definitely want people to know, which is that you can still transmit COVID even if you have no symptoms. I think that's very important because sometimes we're used to identifying the presence of a virus or sickness with the ways in which we change physically, right? And so what we are coming to understand is that at least a quarter, if not more, of those who have this virus will be asymptomatic, right? So they are not going to show signs of symptoms, and they're going to move through. They may not even know that they have it, right? And even if they realize that something is amiss, it might not affect them in really significant ways in terms of compromising their health. And then for others, it's going to have an acute impact, right? Which could even lead to death. So it is important for us that when we are protecting ourselves to know that we are also protecting others, right? And to take the extra precautions to keep ourselves safe and well to the best extent possible. And that includes all the behaviors that we talked about before that are important about keeping our distance, sheltering in place if and when we can, right? Covering ourselves up to the extent possible. If we don't have PPE, like let's make our own. For people who don't know that acronym, personal protective equipment, let's make our own face coverings, right? So you'll see that right there. Make a face covering from a t-shirt, get that scarf out, like tie it around, like do what you can do. Do what you can do to be well, right? Keep your distance, those 6 feet, practice great hand hygiene, right? Like that washing of the hands is absolutely nothing better that we can do than washing our hands with soap and water for at least 20 seconds. If we've got the, what do you call it? The sanitizer, that's a great thing too. But really that hand washing, keeping our hands from our faces, right? These are the things that we can do. But emotionally, right? What are the things that we can do? And so part of this on our website is about coping, right? Coping with stress and being able to move through it. We might have to be socially, we might need some social distancing in order to keep ourselves physically alive, but we know that we are creatures of relationship, right? We are herd species. We're born in relationship. We die in relationship. We need each other. So I want to make sure that people understand that social distancing should not be social isolation. Social distancing should not be social isolation. These are times when we are being called upon to engage in social solidarity with one another. Pick up the phone, call on the people that you know and love, check on them, Zoom to the extent that you can, have your joint parties, dinner parties over Zoom, have your prayer parties on the line, listen to the DJs at night, get your dance party on a Friday night in your house. Like these kinds of things, we still need one another. Right? That is not diminished by the fact that we have to be careful about the ways in which we engage one another. And so the website has good information on all of these things that we can do, but also encourages us from a stress and coping standpoint to really stay in relationship through this, because the isolation will also kill us emotionally.
Yeah. We have an ambassador who says, remaining socially distant while being emotionally connected.
Indeed.
And I think that's really powerful to understand that both are true, that we can be socially distant, but we need, as you highlighted, that emotional connection now more so than ever. Now, one of the questions we still keep getting is what to do if I'm sick and how to access support. I think many of us are used to that. If I'm sick or displaying symptoms, I call my doctor, or I go to urgent care, or I may go to the emergency room. But we know that that's not the protocol during this time. Can you all walk us through what to do if we think we're experiencing symptoms of COVID-19? How is it that we get the support we need and deserve?
Definitely, this is definitely a time where we are not wanting people to show up in our emergency departments and urgent care. So if you do feel like you have symptoms of the disease, please call your doctor first. If you do not have a doctor, feel free to call one of the county or health department lines. And again, these are resources on our website. I did want to point that out, that we have, when we first started this, there was a lot of question about where are the testing sites for COVID-19? How do you get into one? What are the criteria around that? And so we were able to add to our website the list of testing sites. I think it's down towards the bottom, Sean, if you, it was on the first page. Okay, yeah. Here we go. So we have the sites for where you can go when you get tested. There was definitely a gap in North St. Louis City, as well as the county. And really our community health centers have answered the call to open drive-through and walk-through testing sites. So we have testing sites at Affinia, at their Biddle location. They are now opening one at their Pagedale location. CARES TL has opened 2 sites on their MLK site, as well as Homer G. Phillips. And so also Family Care Health Centers has some in South St. Louis City and County. And so definitely there are a lot more locations than when we started. And then you can see more locations for our hospitals in our county, as well as the numbers you should call before showing up anywhere. Definitely want people to call first. And this really, again, helps reduce the spread of the COVID-19, as well as reduce your risk of being coming in contact with someone who has it. So please call. We do realize a lot of our health centers are now doing telehealth appointments, so they can also, they're FaceTiming and doing different mechanisms to address that. And understanding that is a barrier for a lot of communities. When you have, that implies you have cell phones, Wi-Fi connections, and other things in order to reach out. And so again, acknowledging those are some of the barriers to how we're moving towards this virtual reality that we're in. There are resources for phone services and other things that are on our website for you as well.
So Angie, if I'm experiencing symptoms and if I don't have a medical provider at this time, do I call the site closest to me, or do I call this city number or county number, depending on where I live? Which number should I contact?
So you could definitely, I would probably start with the city and county locations because they can refer you and they can connect you with doctors first through the health departments before you reach out. If you don't have a physician, most of the health centers, well, I think their new sites are taking new patients. So if you're not a member there, you could probably reach out to one of those as well. But definitely start with the city and county numbers if you don't have a provider. Because a lot of these, for the testing, you have to have a doctor referral. So that is just something, again, if you don't have a doctor in this time, a lot of people do go without physicians because of different barriers. Please call your city and county health departments for referrals.
Wonderful.
Indeed. And go. Like, once you get the referral, we want you to go. Because one of the things that we're hearing from doctors in our system is that our people are going too late, right? Because we have a history often of going to the doctor late, especially if we don't have adequate insurance or coverage. One of the things that we do is we don't go until situations get really, really bad because we're afraid about the expense, right? The expense of treatment. And so those are already our patterns because we're in health systems where we don't have adequate insurance, adequate access to healthcare, right? And but the problem is every day matters here, right? This is for those of us who are going to acutely experience this virus. Our health can be compromised, our lives can be compromised quickly. So we're hearing from our physician partners that our people are waiting too long before they call and go. And by the time they get to treatment, there's very little that can be done, even by way of supportive medical care, right? So we need people, the minute they start to feel that cough, the minute they start to get that fever, the minute that they start to have trouble breathing, in that minute, we need them to call, right, and enter into our system so that they can have the best shot of remaining alive and well. That's what it is we want, right? Once they're at that place.
Right. And then emphasize testing is free at our community health centers. And if you need transportation, still call, because they have options to help you get transportation. And definitely heard that was a barrier to a lot of people wanting to go because they felt like they had to pay or they don't have a way to get there. So,
right.
Please go.
So then, again, understanding that we can, if I don't have the means to pay or if I don't have a medical provider at this time, those are not barriers during this time for our health and well-being.
No.
Wonderful. And that's so crucial to recognize. I want to ask, as our time is wrapping up, is there anything else that you want to highlight or share about this initiative and all the work that you've been doing?
I think I want to reiterate the point that Angie made earlier, that this is really a team effort, right? That we've got organizations, 6 different organizations by my mind to my, in fact, it's even more because we have community partners who are all working together to figure out how do we amplify not only our messages, but get this information out to our community members that are most endangered, right? What will we do? How can we be present? How can we use traditional media, social media, but even as important as that, actual physical presence? Like, how can we make sure that we are on the street, in the places where people go, posting up information so that they know that we're here and that we care, and that the key ingredient to that has been our community members each and every step of the way, right? This is a campaign by community, for community, with community. And that is what is really driving what we are doing. And to the best extent possible, we are also sharing the resources that we have. So we've managed to attract and get donations of personal protection equipment. We turned that around last week, and we gave away, through the Urban League's Food and Toiletries Drive, we gave away 1,500 personal protection equipment kits. That included 3,000 face masks, 6,000 pairs of gloves, instructions on how to use it, our Prepare STL flyers, right? Soap for hand hygiene. Like, we are taking in these donations and we are turning it right back out and giving it to community members. And now we're focused on what can we do with our unhoused populations, right? Again, other brothers and sisters in our community. So we're not going to stop. We're not going to stop until we have done our absolute best to keep all of us alive and well.
I think she said it the best. I love it.
So thank you to both of you for making time and space to share this information with us on the Daily Dose. I know that you two have been incredibly busy, and so I just want to say thank you for making time to share this message. And from the very bottom of my heart, thank you for the crucial work you're doing for our community, recognizing that there's the need, unfortunately, to get this message out and get this message out broadly and widely, and doing it in tandem with community. So thank you to you both for your work and what you're doing. For those of you who are tuning in either live or after the fact, please share this information with someone, anyone, everyone. Share it through your social media as you're remaining socially distant yet emotionally connected. Make sure that people have all of the resources, not just for their health, but their well-being, for their financial well-being during this time. So please, as your Daily Dose Challenge, share this information to help keep our community alive and well. So again, a very special thank you to our guests. And as part of our recognition of hashtag celebrating essential. We want to continue this. And today we want to recognize the Red and Black Brass Band that's bringing music throughout the St. Louis community to really share not just their gift of music, but also share an important message. So as we're tuning out today, we'll share a brief clip of what they're doing in our community to keep us alive and well as we celebrate today's hashtag essential, the Red and Black Brass Band.
Wonderful. Thank you so much, Sean. We appreciate you. And I want to say one last thing. Thank you to Angie for her leadership, because we could not do this if she were not in the seat that she's in making this happen. So thank you, Angie.
Well, thank you, Rebecca. This has been great. Great partners at the table. So thank you all.
Well, so as we tune out, watch this little clip from the Red and Black Brass Band.
I can do it. That's cute.